bring Tarso back into the conversation. You're here in part because of the Biennial, and Erin, you run this great event that we're lucky enough to have in Colorado. But it's also an event that's about the Americas, all of them, and I want each of your opinions on this. You know, what is the one drug policy change that needs to happen for us to move forward, you know, in a sane manner, since there's been so much insanity on both sides of this issue? Tarso, let's start with you. What's the one change in drug policy in any of the Americas?
Well, maybe the only and most important change we have to see is to understand that we won't have such a thing like one drug policy change that solves everything.
Absolutely.
This is a very complex issue. We have to deal with it from different fields of knowledge, with different points of view, and to understand the complexity of this phenomena, it's the primary change that we have to develop, because people today, they think that a kind of a law can change everything. But this is not true. This is simply not true. We have seen in many opportunities that changing laws, it's not enough, and many times. So I think we have to understand the complexity and works for prevention and to many connected things that promote health and wellness, you know, that are being put in the second floor. You know, the people are forgetting that making sports, having opportunities in its life, it's more important that have like a police officer in your class to tell you to say no to drugs.
It's not a simple issue. It's not black and white. It's not good and bad. That's a good point.
Yeah,
I mean,
you have to understand it.
It's an incredibly complex social and political concern. Erin, what do you think? What's one drug policy change you would like to see, or you think that needs to be seen?
Well, I guess, you know, I don't have the answers. I'm not a policymaker, but I'd say two things should be considered. You know, and the first really is we have to consider both sides of the equation, supply and demand. We focus for so long on the just say no piece of it.
Sure.
That is really about, you know, don't do it, it's bad for you. And we know all the public health research, although we haven't been able to study marijuana, all the research tells us if you just tell people don't do something, that's like the least convincing and effective thing you can do, right?
Right.
So, you know, we have to have common sense approaches on the demand side, but also...
And maybe that's why you titled the the symposium, Just Say Maybe.
Exactly. But we should also consider, you know, the supply and not be... not have our head in the sand with respect to our friends to the south and the countries that have really borne the brunt of this epidemic of drug use that we've, you know, seen in the past several decades. So it's almost like negotiating a treaty, international treaty, right? I mean, when you're considering a new drug policy, let's just make sure that we're looking at the whole picture. And the other thing is, you know, just base it on science, right? I mean, it would be great to be able to say, here's what's helpful about the cannabinoids, here's what is harmful, and here's what the effects are, and here's how it affects children, so that we can have some real information and not go through another, you know, decades of misinformation like we did with the tobacco industry, where people were saying it's not addictive, it's fine, you know, it's healthy.
Yeah.
So just from a pragmatic standpoint, we need more information, right, before you can have a smart policy, and it sounds like, you know, some of the states where that's legal is we're going to have a chance to do that. But just as a, you know, as a citizen, I'd really like to see this be fact-based, because there's been a lot of hyperbole, but not a lot of facts.
We are desperate for information in this space. I mean, when you compare this to anything else that it's always compared to. Weed is always compared to alcohol, to tobacco, you know, to prescription drugs. And compare this to that, and we have an infinitesimal knowledge of what cannabis is and what its impacts on our brains, our bodies are. You know, Tarso, would you agree?
Yeah, I agree, but do you know something that it's very interesting about this lack of information? It's that for many years, when people talked about legalization, when started writing about legalization back years ago, people always that are against it always mention that, well, the consumption will rise a lot, prices will be lower, and we'll have a lot of health problems in any city. Well, what's happening now is that now we have like a lab going on here in Colorado. So that's why people all over the world are so pretty interested in what's happening here, because by the first time we have such an opportunity to have real information. You know, I've been writing about drug policy and legalization, just about like this speculation journalism, you know.
Sure. Yeah.
Yeah.
Because we didn't know.
What would happen if? What if legalization happens? It's always the same. Now I'm going back home to write what's going on really, in fact, you know, because here we have the facts. So it's gone.
I mean, both sides have their facts, right?
Well,
but
we
I don't
have
feel
the
like we have any
beginning of
science.
facts.
Yeah, we don't have a long term.
Yeah.
But it's enough to have some informations, because people used to say that the rise in consumption will be almost immediate.
Everybody's gonna.
Yeah, you know, everybody that never thought about rolling a joint will be running to the dispensary. You know, it's not happening. No. It's not happening.
Right, and as many, especially many leaders throughout Colorado have pointed out, it's going to be 10, 20 years before we know. Before we fully know this impact, but I think you're absolutely right. The immediate impact is in, and we know that Nancy Grace was wrong. There wasn't a massive crime spree in Colorado the minute legal sales started happening. You know, and at least in the first 18 months, the first year of data, the usage didn't go up tremendously among either age group, the adults or children. So
no, but anyway, if we wait for more 10, 20 years, there will be a data. Now we are able to collect some data. We are waiting for the long term, of course, but now finally we have an opportunity to study it.